Good morning, good afternoon, good evening, and welcome to this first of our 3 Interclean online inspiration and innovation sessions. Today, we hope to inspire you on why cleaning, disinfection, and infection prevention is so important to create safe and healthy environments, and what you can do to create those kind of environments. And we'll also bring to you 2 new innovations to help you deliver these kind of environments. Our session today takes 2 hours. We'll start with an inspiration session consisting of an interactive panel discussion where you as an audience can engage with our speakers and with the rest of the audience. Our second hour will focus on 2 new innovations where you again can participate in the session itself. A disclaimer before we start. This entire webinar is being recorded. You can actively participate, but if you prefer not to be recorded, then we advise you not to turn on your camera and audio during the session, during the breakout sessions. Now, it's time to get underway. We'll start each hour with a keynote address to introduce the session and to set the topic. For this, we are very pleased to be joined today by Professor Jean-Yves Maillard. He is a professor of pharmaceutical microbiology at the Cardiff School of Pharmacy and Pharmaceutical Sciences. His field of expertise concerns antimicrobials and particularly biocides, their activity, mechanisms of action, and the emergence of microbial resistance and cross-resistance to those antimicrobials. He has published over 180 peer-reviewed articles, 19 book chapters, and 3 books, and has over 140 conference communications. I'm honored that we are joined by such an experienced scientist today. Welcome, Professor.
Well, thank you, Robert, for this very kind introduction. It's a pleasure to be here with you. Okay, I'm going to share my screen now and start that presentation in this case.
All right, sounds good. For those of you who may have a question for Professor Maillard, you can ask them yourself in one of the breakouts later on, or you can save your questions for a Q&A that we have in the second part of this event. Professor, your presentation, please.
Oh, thank you, Robert. Well, thank you first of all for the invitations. It is a bit of a challenge for me today because I've got only a few minutes really to introduce such a topic. So we'll see what we can do. First of all, as a reminder as well, what's cleaning and disinfection? I mean, cleaning officially is the removal of dirt, and it's not the removal of microorganisms, while disinfection is killing of so I will start obviously with the obvious, and obviously a very topical matter, which is a COVID-19, on why cleaning and disinfection is so important. And I think it's embedded by the current pandemic. I'm afraid to say it's here to stay for a while longer because it affected many countries. And has been quite a game changer in terms of need for cleaning and disinfections. In many, at least Western countries, we've seen certainly at the start of the pandemic, an increase in cleaning and disinfection as needed. This type of viruses, which are responsible for common cold, usually are transferred through formite, through surfaces. So the cleaning and disinfections at the start were very important. Now we know with these particular strains of a virus, and the main mode of transmission is through the air. So that's a challenge that we'll certainly debate in an hour. So as I said, COVID-19 for us, I mean, it has been, even if it was dreadful, an opportunity to really improve our cleaning and disinfections, and especially for the public to understand the importance of hygiene, basically, and the importance of cleaning and disinfection on measures. But let us not forget that apart from these dreadful viruses, I mean, you've got other microorganisms, especially in the healthcare settings, that are a major issue still. 6 million patients annually with a hospital or healthcare acquired infections, 100,000 deaths or more than that annually. In the UK, in England alone, a bill of 2.1 billion per year for treating those infections. So again, the cleaning and disinfection is a preventative measure that can certainly decrease those number of infections. Now, what's to come as well as a background is antimicrobial resistance. You may have heard about it, where you've got microorganisms, bacteria that are becoming resistant to multiple antibiotics. They're becoming difficult to treat. An economist a few years ago in 2016 released a brilliant document for the British government. As an economist, I tried to put some figures as to what the cost to be about those infections. It's about 10 million deaths annually at the cost of worldwide of $100 trillion annually. So again, those microorganisms we need to get rid of through cleaning and disinfection are here to stay. They increase, and as I said, cleaning and disinfection are absolutely essential for a prevention. Now, briefly about the transmissions. As I said, usually most microorganisms are transmitted via surfaces, even viruses, most of them through surfaces. Either you've got infected individual will release those microorganisms, and you will pick them up on the surfaces or by touching someone as well who's infected. It is more unusual to have airborne transmission. So far it was the influenza virus, but we know now the SARS-CoV-2 is also airborne transmission, which is a bit more complicated to deal with. So again, where surface and cleaning of surfaces is very important is when we've got direct or indirect contact with an infected patient or infected materials and so on. And that's where cleaning and disinfection are so important. Also, as a reminder, when you've got microorganisms on surfaces, loads of them can remain on surfaces for a very long time. Notoriously, you've heard of probably Clostridium difficile or C. diff. It can last several months on surfaces. One virus, a norovirus, a gastroenteritis virus, can persist for several weeks on surfaces. You have heard at the beginning of the pandemic, SARS-CoV-2, then there was a report that the virus survived 3 weeks, but it's only in lab conditions. In reality, that virus doesn't survive very long on surfaces, and I will explain why in the next presentation. But you've got other microorganisms that all pathogenic microorganisms that can survive months on surfaces. So if the surfaces is not clean and disinfected, then you might be able to be exposed to those microorganisms. So the challenge for any product or solutions is not only the product itself, but it's where it's being used, but also compliance by the end user. So when I view products with company, for example, and advise on product, you need to look at the global picture. It's not only your product that is important, it's where it's being delivered to the surface to do its purpose, cleaning or disinfection or on disinfection, but also how it's going to be used in instructions on compliance by the staff. And in fact, when we're looking at compliance alone, hand hygiene has been so important last couple of years, but we know before that hand hygiene compliance in hospital were between 30 to 85%. And that's really is too variable on cause problems there. As for surface disinfection, again, in hospitals, compliance would be varied between 23 to 40%. So again, we've got scope here to improve the way we clean and disinfect surfaces. Efficacy of product. Soiling is very important. That's why usually we ask when you've got evidence of heavy soiling to clean before you disinfect, because when you've got heavy soiling, then the disinfectant not going to work as well. When the surface is not visibly soiled, then it's easier for disinfectant to work. Contact time is very important. Again, as a parallel, again with COVID-19, your hand rubs you put on your hand. If your hands are dry within 5 seconds, it's not working. You need to have at least 30 seconds to 1 minute contact time for a product to be quite active. On usage, very important, as I mentioned. Guidelines, you need to follow some guidelines to hospitals and obviously for the government, but very important for the manufacturers is instructions for the end users. On where I see the most problematic aspect of it is when the products need to be prepared in-house, where very often it's not used appropriately or not prepared appropriately, so it loses efficacy. Here I put in terms of usage, I put risk as well, is transfer. You know, now you've got a huge amount of product based on wipes. We've done lots of work showing that if the wipes is not appropriate, you're going to transfer microorganism around the place rather than killing the microorganism or removing the microorganisms. So overall, my conclusion is cleaning and disinfection absolutely essential. It is challenges. Well, you've got many challenges. On one is obviously it's highly competitive field as well between lots of different manufacturers, and especially now under COVID-19, we've got now so many products claiming efficacy. Challenging as well in terms of compliance and product usage as well, which might not be really explicit. Compliance can always be improved. On the next session, I will say about automated devices on other surfaces, for example, that can help in terms of compliance. And of course, innovation. Innovation is still there, and that will be the challenge of the next my next intervention in an hour. Thank you, Robert.
Well, thank you, Jean-Yves, and my compliments on how you were able to dissect such a very broad subject into only 5 minutes. So I'm very glad that you will stay with us for a second presentation later today, but also for our panel discussion that is coming up now. An interactive panel discussion where we basically will continue where Professor Jean-Yves Maillard will left off. We're going to discuss, for example, the social, economical, and hidden cost of not cleaning properly, look at sustainability versus stricter hygiene needs, and maybe also even the lessons learned from the pandemic, but also the challenges still to come. For this, I would like to ask two other panelists to virtually join us here in the studio. The first is Denise Hansen. She's the head of technical services at the British Institute of Cleaning Science. Denise has over 30 years of cleaning and hygiene experiences in a career that spans facility services for local government, major food retail, shopping centers, clean room, and office facilities. Thank you for being with us today, Denise.
Thank you, Robert. Thanks for the opportunity to talk to people.
And the third panelist is Professor Christine Rock. She is a professor in industrial microbiology, hygiene and environment of the Faculty of Pharmacy of Toulouse. And additionally, she is also the president of the ISO TC 330 committee, which is the International Technical Committee on Antimicrobial Surfaces. Now remember that last word, antimicrobial surfaces. But as I mentioned, this is an interactive panel discussion, which means that you as an audience can join the discussion later on as well. Let me explain to you how this is going to work. We're going to start with let's say it, traditional panel discussion here in the studio between me and the panelists. But after about 10 minutes, we're going to ask the audience to join us in a number of breakout rooms. We'll split up the audience in 4 groups. 2 groups will go with me and Denise, where we're going to continue the panel discussion, and 2 other groups will deep dive into the world of antimicrobial surfaces, which is supported by our partner Metalskin. And additionally, Jean-Yves and Christine will also join those 2 breakouts. I'd like now briefly introduce the moderators of Metalskin, who will help you in those 2 breakouts. So I'd like to ask Stéphane Penari, the founder and CEO of Metalskin, to join us, and his colleague Grégoire Huber, business development manager. Stéphane, could you very briefly give a 1-minute pitch on what Metalskin is and what you're going to do with the audience in the breakout?
Thank you very much, Robert, for leaving me the floor. I will be brief. Well, Metalskin was created like more than 10 years ago, and we've been working on antimicrobial surfaces for that long. So we are kind of pioneers in this topic. And our goal today is to present how this kind of surface combined with cleaning procedure and disinfection procedures that are correctly implemented can lead to obtain greater results in terms of surface hygiene. So that will be pretty much what we're going to expose today.
Sounds good. Thank you very much. Now, that's the breakout. After this breakout, we'll return back to our main session here, where we'll continue the panel discussion. And then after a brief time, we'll go into our second round of breakouts, where we turn everything around. And the first two groups that were with me and Denise will go on to the Metalskin breakouts, and the two Metalskin breakouts will return to Denise and myself. So thank you for now, Stefan. I look forward to, the audience will probably look forward to seeing you in the breakout. And for us, it's time to start the panel discussion. Let me start by talking about some of the things that Jean-Yves mentioned in his presentation. We talked a lot about what is scientifically necessary. Jean-Yves explained what is scientifically necessary, but we also see that there is often a lot of hygiene theater to make people give the impression that things are clean, safe, and healthy. Would the panelists have a comment on that, on the, well, let's put it, the balance between what is scientifically necessary and what looks clean and feels clean to the users?
From my point of view, sorry, Jean-Yves.
Denise, you go.
What looks clean isn't always clean, particularly on a biological format, but also conversely, what doesn't look clean gives people far less confidence in that area. So really it's a balance between the two. And also the fact that the cleaning always has to take place first for the disinfection to actually be effective.
Anything you want to add to that, Jean-Yves?
Yeah, I was going to actually speak the same. And the biggest challenge you have is when it's visibly clean, doesn't mean it doesn't have many microorganisms or pathogen on it. And that's the biggest challenges. And we know some practices where in terms of cleaning, they've got a very shiny coating, but doesn't do anything, and it's still got microorganisms there. So it's always been the difficulty, the perception of it looks clean, so it's free of microorganisms. In most cases, possibly, if it's real clean and well tended, fine, but it's always, it's why as scientists always had difficulty in convincing people saying, well, clean, that does not mean it is safe necessarily. And as Denise said, I mean, when it's dirty, I mean, again, if it's just dirt, it doesn't mean that you've got pathogens in there, but it's just perceptions that you need to do something about it. So it's always the issue. And when I was mentioning compliance, especially in hospitals, that's the main issues. The surfaces look clean, so they're not being tended well they should.
Anything you want to add to that, Christine?
Thanks for the floor. I totally agree with the position of Denise and Jean-Yves. It is of evidence that we have a real difference between visual perception of cleaning and disinfection and microscopic evaluation of that. And it may be very difficult because some products permits to have a good look of the surfaces, but in fact they retain microorganisms, and so they retain them alive, and so the transmission may occur even without this kind of product.
And what can we do to convince the general audience of that? Because I'm sure that well, we are all in agreement. I expect that many of our visitors watching will also be in agreement. But how do we convince someone who is in a building that looking clean is something different as actually being clean, or actually being safe, or being disinfected, or being hygienic?
Sorry, I missed that, Robert. I was looking at the chat. My apologies. So could you repeat that, Robert?
Yeah, well, I was asking, how can we help the general public convince about this importance as well? I mean, I think we are all in agreement that it's important to have these kind of safe environments, that clean is something different as being hygienic or being safe. But there's also a bit of a responsibility on the users themselves to keep things clean, to use the hand rub that you mentioned in flex offices to clean your table after using it. How can we educate the general public on this?
Okay, if I start, if you don't mind, Denise and Christine. Apart from, let's put healthcare and hospitals on one side. Let's talk about home as well as corporate offices as well. I mean, for that is you don't have to clean and disinfect absolutely everywhere. It's called targeted hygiene. It's knowing where you might encounter those pathogens and deal with that. So at home, it's mostly about bathrooms, toilets, but also food preparation area where no matter what, even if it looks clean, well, you need, again, before you prepare food, to clean your surface and then you prepare food. So it's just those little habits to have. Now, as for one of the main culprit in terms of transmission of microorganisms wherever are the hands. So hand hygiene are so important. And what I'm hoping to see is people get a habit of using hand rubs or hand gels every time they go somewhere or they touch surfaces and so on. And my colleague Didier Piter with Mr. Hand Hygiene told me once, and he's absolutely right, the objective is is the same as when you go in the car, you put automatically your seatbelt on it without thinking. And really our objective would be then when you're doing something, when you touch surfaces like in public transport, automatically after you would clean your hands. And if we could achieve that, that would be absolutely fantastic.
Sounds good. Do any of the other panelists want to add to that?
If I could, one of the things that we are all about, if I'm honest, at VIX, is about the method of cleaning and actually people cleaning properly, because people aren't born being able to clean. They need to be shown how to, they need to understand why they do things in a certain way, why it's safe, why they clean from a clean area to a dirty area so they don't cross-contaminate. It's about people having that understanding. And I think at the moment, certainly for us, we've never been busier, but certainly people want to know more about the why, not just the look, what is underneath that look. And I think this is a great chance to actually do that.
Sounds good. And from your side, Christine, we talked, Shani briefly talked about surfaces. You are an expert when it comes to microbials living on surfaces. So perhaps you can add to that as well.
Well, I think that we have to insist regarding the role of a cleaning step. And most people forgot that cleaning has a role in the removal of microorganisms by mechanical action, also a chemical and mechanical action. And many times at home, it may be sufficient, and we have not to put disinfectant on the surfaces. And so it is very important. Jean-Yves talks also regarding hand hygiene, and it is of evidence that during the pandemic, we insist regarding the hand wash. And we have to take into account that many times hand wash is sufficient, and we have to take hand rub when we have no water or when we multi-touch surfaces. So it is very important to define when I use what kind of product and what kind of procedure.
I mean, the only addition I would have is certainly a long time ago when I started in this field, then you had really two distinct products, cleaning agents and disinfectant. And as I said in my introductions, when the surface is visibly soiled, cleaning first. But now I've got to say, now you've got more innovative formulations where you've got some special component in those formulations that enables to do that cleaning step as well. That will have some disinfectant. And that's answer, I think, one of the chats you have here for me, with my personal opinion and experience. And you've got some very good product that can do both the cleaning and disinfection at the same time. That simplify things. But again, they need to be appropriately tested, that's for sure. But combining cleaning and disinfectant into one product is is possible.
Okay, sounds good. Moving on then towards sustainability. We talked a lot about stricter cleaning and hygiene, but I think also in the pandemic there was suddenly a lot of waste being used because people were over disinfecting, over cleaning. Do you have any thoughts on that?
I think from my point of view, I was one of the people shouting at the telly when you saw them in their Ghostbuster suits going from one building to another in the same suit and not cleaning before they did anything. So other than being hoarse, again, it comes back to the fact of clean when you need to clean and then disinfect afterwards so that the surfaces are clean to let the disinfectant work. But also for people, like those people going building to building, were they actually safe? Make sure that the operatives are safe in doing what they're doing and they're not putting themselves at risk. They're actually going home safe as well as making it safe for the people.
Yeah, because those were those frontline workers that were putting, well, almost their lives at risk to keep those buildings clear, or to maybe not even in the right way, or maybe not even in a sufficient way or in a useful way, but still they were being sent out there to clean all those things in their Mythbusters and Ghostbuster suits. It's time to move on to our first breakout round. Thank you for now, my dear panelists. I will come back to you for our second round. And it's now time to start the breakouts. So for the audience back home, we are going to press the magic button and put you in your first breakout session. One group will go with me, one group will go with Denise Hansen, and one group will go with Christine Rook and Grégoire Hubert, and one group will go with Jean-Yves Maillard and Stefan Benari. Now, it's an automated session, an automated system process from Zoom, but it may take some time. So if you have not directly transported to your breakout room, please give it a few moments and don't worry. And then once you're in your breakout, don't be shy. Don't hesitate to turn on your camera, to turn on your sound and engage in the breakout with your peers. I look forward to seeing my group in my breakout, and I look forward to seeing the rest of you after about 10 minutes when you'll return to the main session here. All right, everybody's coming back. Everybody's coming. Sorry for that. We're still getting used to using the breakout rooms ourselves as well. Thank you. I think everybody is slowly coming back into the main room. When you leave the breakout room, please turn off your camera again and your microphone, except for our panelists and speakers, of course. Looking at the number of participants, it seems that almost everybody is back again. So before we move on with the second part of the panel discussion, let me just briefly go to one of our breakout moderators to ask for the experience. Stefan, how did your first breakout go?
Well, it went very well. It was short, very quickly. Well, some topics were assessed, and as it is recorded, probably we will assess other ones with Jean-Yves in the next breakout session.
Okay, good. Thank you for that. And we look. I think the audience will look forward to seeing you in the second breakout. We'll continue with the panel discussion here, and in about 8 minutes, our second breakout will start. Panelists, thank you for being back with us as well. Let's talk about disinfection versus cleaning versus infection prevention. Well, we've already been doing that, but what are some of the most important misunderstandings when it comes to cleaning versus disinfection? For example, when you think about things as when to clean, when to disinfect, what to disinfect, what not, etc. Who wants to take that question?
Okay, well, I'll start again, Robert, in this case, if you don't mind, Christine and Denise. For me, I think it's a complete misunderstanding of the terms. On very often people talk about cleaning when they mean disinfections and so on. So there's no really, at least for the public, sometimes a real confusion as to what is what. And even with manufacturers where, I mean, as I said, the definition of cleaning is the removal of dirt. You're not talking about microorganisms here whatsoever. But then you see on some product packaging where they say the cleaning on the removing of microorganisms and cleaning. That is not right. But where it's confusing a bit more is certainly your cleaning agent on your material, if you've got a wipe or anything like that, will remove microorganisms as well. It doesn't kill them, but it will remove microorganisms. And we've published, I mean, quite a bit on that one, where some products for me are quite dangerous, especially the way they're being used and reused, and it's part of education we mentioned early on. Education is absolutely key when you've got those type of product is for one surface only. If you're starting to use the same product on multiple surfaces, you're spreading microorganisms around just because of the formulation, the cleaning formulations you have with surfactant, and that's what's going to happen. So the confusion is in terms on what the product is supposed to do.
Thank you. Any comments from the other panelists?
I think that there is also confusion regarding the claim for some products and the labeling. And it is very important to take in consideration if they really demonstrate the efficiency. And currently we have on the market some products claiming disinfectant or bactericidal activity, but without real demonstration of this activity. And it is a very, very important point. We have also some products for anti-Hygiene, which are not tested, and so we have not demonstrated real efficiency.
I think we'd also agree the testing is key. So people actually having the checks in place and independent checks rather than in company checks that the products are effective, but also then stating how they're effective. So what is their contact time? How should they be used? Because there's a vast difference in contact times from 30 seconds to 5 minutes. And in cleaning, it tends to be a race to the bottom of who can deliver the most effective clean or even the prettiest clean for the least price. And perhaps we need to look more at how that cleaning and clean is delivered and to what standard.
And how should we do that? We need to look at it more, but what would be the first step to start looking at it more?
I think it's education. Well, for me, it's education. And I'm trying to educate infection control nurses in the UK, especially the one who's got the power of buying product. And what Denise was saying, I mean, if they've got being sold a product like a wipe-based product that works 60 minutes against, let's say, SARS, it's not going to be useful whatsoever, because you know that the contact time you're going to have is about 10 seconds for the surfaces. You might have it will dry within probably 30-40 seconds because you don't like your surface to remain wet. So the activity of those products within 60 minutes killing the bugs, it's ludicrous. So education as to what the product is for, on really looking at the label. I mean, I guess you've got all the standard tests that those companies need to do to make a product claim on label. But again, that's some of those tests as well is purely to demonstrate some activity. It doesn't mean that the product will work in practice, unfortunately.
Thank you. Any other comments?
I think that a good labeling may indicate the contact time and all the condition of good use of a product. And it is the most important thing to check, because as underlined by Denise, the contact time and the condition of use, the dilution of a product are very important. And so we have to have very clear indication on the labeling of a product.
I mean, Denise mentioned earlier on as well, not only that, but instruction how to use a product is absolutely key, or prepare on use a product. Don't be surprised how sometimes poor those instructions are.
All right, thank you. We talked about testing, we talked about testing of products. There are also a lot of, let's just call them new technologies, new products coming to the cleaning industry, partly coming from other industries that are now used in general cleaning because of the pandemic, such as UVC cleaning, or air purification, air ventilation. Another thing that's coming up is antimicrobial surfaces. Metalskin is talking about that in the other session. How do you see those kind of technologies? Christine, you are involved in a lot of antimicrobial research. How do you see this coming into the cleaning industry and its effectiveness?
Currently, we have many research and development regarding new process for cleaning and disinfection, and it is of evidence with the pandemic. The most important thing, perhaps, is to consider that when a new process is under progress, it may be very difficult to demonstrate the efficacy. And as we underlined, we have some standard in vitro, and we have also to demonstrate the efficacy in real conditions. And it may be very, very difficult for new process, as an example. And on the other part, if I take the example of a steam process, steam apparatus, we may observe that there is a great variability in efficacy regarding the process. And so we need some standards to evaluate at first the efficacy and to permit to manufacturers to select the most efficient and to ensure to end users that they use the good process. But if we look now at a new way to work, we see that we have antimicrobial surfaces, but we have to take into account that antimicrobial surfaces exist for a long time ago. It is just that they are on light because of the pandemic now.
Yeah, so it's not new, but it's being pushed more and being seen more as an effective solution to a big problem. Well, we're already running out of time for this part of the panel discussion, so it's time for the second breakout. As I mentioned, the groups will be turned around, so everybody will be in a different breakout room this time. So let's push the magic button again and start the breakout rooms.
Hello, everyone, and welcome to this breakout rooms together with Professor Jean-Yves Maillard. I will briefly introduce Metalskin technology and the antimicrobial surface. And if you have questions, just press the raise your hand button at the bottom of the screen. So let me share my presentation that I will make as fast as possible. So Metalskin is basically a coating or an adhesive tape that we have developed since 2013, and that has permanent antimicrobial action versus bacteria and SARS-CoV-2. This is a patented technology that we aim at combining with proper cleaning and disinfection processes. We did that in a first study in a clinic in Montpellier, where we combined the regular disinfection and cleaning process together with a touch surface covered with Metalskin, with comparative study in 6 rooms during 8 weeks on 7 items. And the result is, as you can see, a significant lower load of bacteria on the Metalskin treated rooms, and we observe also a gap of contamination between treated and untreated items that were increasing over time. I mean, the more we got in time, the cleaner the Metalskin items were compared to untreated elements. And during all of the study, the global load of bacteria on treated and untreated items combined was lowered by 38%, which was a very interesting outcome. We did another study in a bus recently in Roissy-Charles de Gaulle, so this is a very used bus every day on 7 items with a different evaluation with ATP-metry. And the result was the aim was to compare what was as load before disinfection and after disinfection, and the results were.
Welcome back to the main room. I see that some of the other breakout rooms are not back yet. So bear with me for a few moments while we welcome back all our other guests from the other breakout rooms. I see that that all the guests have turned off their camera and sound again. If you're coming back from one of the breakout rooms, unless you're a panelist or a speaker, please turn off your camera. again and your sound again. And yeah, we're back. Everybody is here. And that concludes the second breakout. And it also almost concludes our first hour. Just want to go quickly back to the breakout rooms. Stefan, are you still with us? How was your?
Yes, I am.
How was your second breakout? Able to get some?
I think that we're going to form a good team with Jean-Yves. I think the topic is really fascinating. Sorry, and Jean-Yves is such an expert. That's always a pleasure to discuss. Yes.
Yeah, well, I'm glad to hear that. Denise, how was your breakout?
Be glad for my breakout group when they actually get to the two professors. So, because I can do methodology of cleaning, not so much the microbiology of it.
All right, sounds good. Well, we're concluding our first hour of our session. So I'd like to thank you very much to the panelists, to Professor Christine Rox of the Faculty of Pharmacy of Toulouse. Thank you for taking the time to join us today and to educate us and the audience on antimicrobial surfaces and everything involved around that. Denise, thank you for sharing your 30 years of expertise in the cleaning industry with the audience. Always a pleasure to see you. And of course also Stefan and Grégoire from Metalskin for sharing your views. I'd like to ask Professor Maillard to stay with us, and the others, thank you for joining us. You can of course stay online for the second hour, but I'd like you to turn off your sound and camera for now. For the people that are only tuning in for the second session, we are now in the innovation part of our session, on our session about cleaning and hygiene today. We've just had a panel discussion where we talked a lot about infection prevention, about cleaning, about disinfection, about when to disinfect and when not to. On targeted hygiene was a topic that came up a lot. But now we're moving into the worlds of trends and developments, the world of innovation and all kinds of new solution services that will help you create a safe and healthy environment for the users of your facility or for the facility that you serve. We're going to see two presentations today, one on how data-driven solutions can support better hygiene and efficiency in a healthcare cleaning setting, and a second presentation on how facility management companies can help shape the future of disinfection in healthcare. But before we go to those presentations, Professor Jean-Yves Maillard is still with us. For those of you who missed his first introduction, he is a professor of pharmaceutical microbiology at the Cardiff School of Pharmacy and Pharmaceutical Sciences. He's already giving a very good presentation on the importance of cleaning and disinfection, and he'll deep dive now a little bit more into the future context of cleaning and disinfection, some forthcoming technologies, and some challenges and pitfalls. If you have any questions for Jean-Yves Maillard, please drop them in our chat so I can ask them to him after his presentation. The floor is yours again.
Thanks very much, Robert. And here we go again. So let me share my screen. Here you go. Right. So that second presentation, again, the challenge is it's only about a few minutes as well. So it's very, very difficult really to cover absolutely everything, and I probably will miss some thought. But I'll give you some of my thoughts on where the challenges are, on where the potential innovations are. There's always an innovation in the field of cleaning on disinfection. So to start with, we'll start again with something I presented early on. It's about the transmission of microorganisms, where really the main challenge before where I'm not sure, someone is writing on my on my slide, which is a bit strange. What we know is microorganisms are transmitted usually via surfaces. The latest challenges certainly with the SARS-CoV-2, the COVID-19, is airborne transmissions. And airborne transmission is a real challenge. as I will demonstrate in a minute. And there's plenty of innovation here, but very challenging ones for any companies that can tackle the disinfections of the atmosphere, especially in a corporate environment, but also hospitals, schools, public transport, and so on and so forth. So again, briefly, what are the solutions on where we can innovate is when we're looking at really transmission from surfaces, is, well, you've got plenty of solutions. We've got a use of a liquid disinfectant through the medium of sometimes pre-wetted wipes. We've got a forthcoming UV irradiation and fumigation. So those are a really powerful solutions. We've got antimicrobial surfaces, and here I put a question mark, and I think Stefan gave a good presentation for his company. There are some limitations about antimicrobial surfaces, but they're part of the solution. On all those fields, you can still innovate. It's not because the technology is already there, there's still scope for innovation, especially when we consider that compliance really either from hand hygienes to avoid a microorganism you pick up from surfaces and passing them to someone else, or from surface disinfection, compliance is very low. So there's loads of things that can be done here in this field to improve that. So where I would start as well is very often is companies don't know the target microorganisms. On different, I put that slide in because different microorganisms got different susceptibility to disinfection. Envelope viruses like SARS-CoV-2 are extremely susceptible to anything, so it's not really a challenge. And in fact, I don't really work with usually envelope viruses because there's no really interest because everything killed them. Bacterial spores, I mentioned Clostridium difficile is the challenge, certainly to get rid of. But other viruses like the norovirus, I mentioned in my first presentation, is also quite a challenge as well, because it's quite tough to destroy. So depending on the applications of your product and where you apply them, you need to know your pathogens, because some of that you might have a formulation that is too active or not necessarily. And usually those formulations that kill, for example, spores, that tends to be far more expensive because of the type of formulation they are. Now, in terms of innovations, here we're looking at liquid formulations, for example. There are complex formulations where you've got quite a number of aspects you need to consider. In all of them, there's still a scope for innovation. For example, a spectrum of activity. At the moment, there's a drive to include viruses, but especially non-envelope viruses like the norovirus. There's a drive to decrease toxicity as well, so you don't have to wear gloves, or they're not going to be toxic for the end users, but also for the environment. So the green technology at the moment are very important, are still scope here to improve. Other performance, cleaning, but also residual activity as well. How long, if you treat your surface with your product, how long it will last on the surfaces. So again, loads of scope here for existing technology to be improved and still to innovate. When we're looking at pre-wetted material, for example, here's the slide with different factors affecting those type of product, or pre-wetted wipe. Again, loads of scopes to improve the formulation itself, knowing the material. The biggest challenge is biodegradations of the material itself, biodegradable wipes. And then also innovation in the way they're being applied and education of the end users as well. So plenty of scope for innovation here. But still, we've got problem with compliance with those products. So education is very important. I mentioned clear instruction as well. You can innovate with clear instruction on your packaging as well. Monitoring, for me, it's part of selling your product, especially in healthcare, healthcare settings, where not only you sell your product, but you offer to monitor the efficacy of your product on what's going on. And of course, where compliance is really going to improve with those automated systems. Whether or not you will see the UV radiations, for example, or fumigations help, but also antimicrobial surfaces or modified surfaces where they're always there, those ones. So they always comply if you want. So if we look briefly at automated systems, so here I've got two of them. So I'm sorry, but I'm not supporting any product, but I've just noticed I mentioned the name of the company here, but I'm not supporting any product generally. So here you've got at the top and the bottom, you've got use UV disinfection. At the moment, the limitation of those products is you've got to have people leaving the room to be able to use them. There's a new one being tested at the moment that claim that you can use them while people are present, but we still need to see the results of those. And those have been a real innovation for the last 5 years. And now you've got really automated system that can actually disinfect transport hubs like airports or train stations automatically at night. Fully automated. The same with hospital rooms as well. And the advantage of those one is if the surface is visibly clean, those will work very well as well. So you don't need to pre-clean if the surface look clean to use the system. So on the very powerful, within few minutes, they will kill any microorganism, including spores, on the surfaces. The one in the middle, ozone fumigation, hydrogen peroxide fumigation, the most powerful systems ever, extremely powerful. The problem is you need to have nobody in the rooms when they're being used. If it's a large room, it can take several hours to do so as well. But again, those are very powerful. There's still way to really improve the systems to make them less toxic. Now, surfaces, antimicrobial surfaces, as Stefan mentioned, they might be limited in dry condition. They do not replace cleaning and disinfection, but they will certainly contribute to ensuring you've got lower number of microorganisms on surfaces over time. So they're pretty good. But one we might consider as well in terms of innovations is where we can treat the surfaces to improve the use of cleaning on disinfection agents. So again, plenty of scope for innovation. So still challenges is, as I said, cleaning disinfection when people are present, especially in view of SARS-CoV-2, automated systems when people are present. Biggest challenging of all the manufacturers are efficacy, demonstrating efficacy in practice versus lab testing, because very often the lab tests are not appropriate for those new solutions. Very difficult to prove their efficacy, or to get the product registered as well, on how to make a product claim on label. Sometimes it's very difficult with completely new technology, which are not adapted for those lab testing. Of course, there's always issue with regulation on a registration costs in Europe as well, which sort of negates somewhat those type of innovations. Thank you very much, Robert.
Thank you very much for again sharing a lot of information in a short amount of time. I see that some questions came in via our chat, so I'm just going to look at my screen over here. This is not going well. So, for example, a question from James T. He is asking, SARS-CoV-2, would that be affected by activated plasma? Is that within your scope of expertise, Shani?
Sorry, so that again, where's the questions?
It's in the chat.
Can you repeat? I can't see. Can you repeat the questions, please?
The question was, if you believe that SARS-CoV-2 would be affected by activated plasma.
Oh yeah, completely. I mean, yes. I mean, plasma technology is very powerful. I mean, it's based on the release of radicals, massive dose of radicals. So, as I said, SARS-CoV-2, it's an envelope virus, is very, very fragile overall. And if you're looking at survival on surfaces, it doesn't really survive very long. I know the government at the start saying it can survive up to 3 weeks, but in very lab conditions. In reality, it does not. So it's a very fragile virus, so it will be certainly activated by activated plasma. Yeah, no doubt about that.
Thank you. Another question came in was, someone asked, I hope I pronounced his name right, Groji Jovanovski. He is asking for your opinion on the potential of probiotic hygiene versus the traditional cleaning and disinfection, especially keeping in mind their pros like AMR creation,
Yeah, well, thank you for that question. I think it's excellent because I didn't mention that at all in my innovation talk. And of course, I mean, probiotics are very important, and we can start to see some product about hygiene as well, especially based on a certain probiotic strain that will prevent, for example, like Candida and Candida thrush. That's very well. There is also, as you know, this product really, we can call them probiotic based on Bacillus subtilis, where you spread Bacillus subtilis on surfaces. I mean, it's registered disinfectant. The problem with that in hospital, at least in the UK, I know that's being used in Belgium. The problem with that in UK hospital is you tend to spread quite a large amount of Bacillus subtilis. So you're going to have it in the entire hospitals as well, in the air conditioning system and so on. And although it's non-pathogenic as such, where you're talking, but if you're thinking at very high concentration of the bacillus, what it would do to a naive patient, and that's always that question mark, whether it's safe, how safe it is. And I don't have the answer to that one, but probiotic, absolutely, as innovation as a product for surfaces, especially for skin hygiene as well, definitely.
Good, thank you. Well, we're almost running out of time, so a quick question to answer, to ask for you to answer. Hopefully, you concluded your slides with some challenges, but what would be like the quickest win that the industry or the cleaning industry or in general, that would be your advice?
Well, that's a tough one. It's very difficult, that one, to answer. Personally, I quite like the UV irradiation systems because it's fully automated. As I said, the disadvantage is you can't have people around when you're using them, but it is extremely fast. I've tested some in my lab, and I didn't believe the technology to start with because you're thinking it's an old technology based in 1960s, 70s and was new, but it's very, very efficient, and I'm very, very impressed by that. So I've been happily surprised. So I think I quite like the UV360 personally. All
right, thank you for that. And in general, thank you very much for joining us today, for sharing your views and your expertise in your two presentations and in the panel discussion and in this Q&A. Of course, you're welcome to stay online for the remainder of the session. But from my side, thank you very much for joining us today. And then we're moving on to our two innovation presentations. Again, an interactive session. We're going to watch two live presentations, followed by a Q&A, but then again, an interactive breakout session. So after the two presentations and the Q&A, you'll be able to engage with the presenters, but also with each other to talk further about the topics discussed in the presentations. For the first presentation, I'd like to ask to the stage Marcel Kolkman and Ruben Gaasbeek from Tork. Marcel is the regional account manager for Tork. He's been working over 7 years at Tork, and he is he calls himself a champion of working smarter and enabling cleaners to take a leap in data-driven cleaning. Ruben is relatively new to the cleaning industry, joined Tork last April, but he has a lot of experience in the field of sterile environments and is now looking how to put that to use in the healthcare industry. They'll be talking about what healthcare managers can do with all those new challenges that they see when it comes to hygiene, safety, and cleaning quality. If you have any questions for Marcel and Ruben, drop them in our chat or save them for the breakout. But for now, I'd like to give the floor to Ruben and Marcel. I think we're waiting for their introduction video to start. There it goes. Sorry for the delay, gentlemen.
Hello, and thank you for joining the session on how data-driven solutions supports better hygiene and efficiency in healthcare cleaning. My name is Marcel Kolkman. I'm Key Account Manager for Tork and SAT brand.
Hi, and my name is Ruben Gaasbeek. I'm the Hygiene Advisor, also for Tork. Thank you very much.
Take it away, Ruben.
So today we are going to take you through some subjects of how data-driven solutions can help you in a better efficiency in healthcare cleaning. First, we will talk about the optimized efficiency. Then we will take you through how to increase your hygiene and quality. And last, but certainly not least, how to empower your team. During this COVID-19 pandemic, this has added more pressure on the cleaning services, especially now with all the complicated wearing of PPEs staff has to do. The Essentials Initiative survey showed that 70% have a higher expectation of the hygiene standards within the hospitals since COVID-19 has broken out. And this brings us a couple of challenges. The first challenge is generating operational efficiencies. A top priority is getting the work done, or even more work done, in the same amount of time and managing the costs. The second challenge is hygiene. Hygiene has always been a given standard in healthcare. And third, but not least, is the cleaning operations are challenged by the high levels of staff turnover. Consequently, facility managers struggle to ensure cleaning quality and must invest a lot of time in recruiting and constant training and retraining. This is compounded by the fact that cleaning is shift-based work, meaning frequent shift changes and hands-offs make it harder to account for responsibilities. How can you increase your efficiency in keeping the high quality of cleaning standards? Well, this is how data-driven solutions comes in. The way we used to work is no longer valid anymore. The approach we used to have are no longer enough. Marcel will show you how it can be done. Marcel.
Thank you, Ruben. Okay, I would like to take you to a trip, what we call data-driven solutions by Torque. So the solution is what we call data-driven cleaning. And let's take a little bit more deep dive in what we've highlighted as a challenge. In this case, the efficiency. We aim for more efficiency by making sure that the cleaner knows exactly what to do at what time, which means he doesn't open and close dispensers that don't need refill. It's a waste of time. The cleaner does not visit a location which has no visitors in between cleaning. This is quite important because what we do in standard is we focus on frequency-based cleaning. And this is a preset number of cleaning rounds with a preset number of dispenser checks. So when we do what is necessary and when it's necessary, we see that cleaners find more time. As a matter of fact, when we ask our customers, 82% of our customers claim that they have increased their efficiency in some way. Either it's making sure that they have less complaints, or they have better efficiency in terms of number of cleaning rounds, or just simply not opening and closing 90% of their dispensers due to the fact that they know where it's needed. So, making sure that you have enough product and clean and refill at the right time will help you to increase your quality and hygiene. That's the second challenge. Let's take a better look at what we see at our customers. For example, this is a customer where we show a graph of a customer who had sensoring in the dispensers, but they didn't use the sensors yet. They didn't use the data. So we measured the number of dispensers multiplied by the number of minutes that the dispenser is empty, and it was a result like this graph. It shows a lot of empty dispensers, a lot of empty dispenser time, and it's basically every day. So frequency-based working is not sufficient in making sure that you have your dispensers equipped all the time. Then we started training the customer, in this case the cleaning staff, and all of a sudden you see a firm decrease of number of dispensers that are empty. So the empty dispenser time has dropped significantly. As a matter of fact, on average, our customers have 85% less time with empty dispensers, which is great. Then, of course, the challenge about making your cleaning staff engaged, keeping them happy, keeping them on board. It's very important that they get recognized for what they do and recognized for doing the right thing at the right time. Data-driven cleaning will absolutely help them doing the right thing at the right time. The sensor will provide the right information for the cleaner to be present at the location where it's actually needed. And when we ask customers who work with Torque EasyCube, how it's received by the cleaner, by the cleaning staff, we always get feedback that they are very happy, that they are working with a system that really makes sure that they don't get complaints and they do work that is very useful. They don't do repetitive work, they do where they are actually required to clean. So not only we are helping the customer and the cleaner to work with a data-driven solution, but we also, in addition, have a Torque training package, including a presentation on cleaning strategies, and it's downloadable from Torque Online. Torque Interactive Clean Hospitals training trains you and your staff interactive in daily cleaning and discharge cleaning. It is available in more than 20 languages, and you can adapt it to your healthcare facility. So all in all, the data-driven cleaning helps healthcare facilities to overcome both long-standing and new challenges. Long-standing challenges in terms of efficiency, making sure that your staff gets motivated, and new challenges in terms of increased hygiene, expectation by the customer. And we have proof of evidence. We have multiple hospitals within the Benelux already using Torque EasyCube sensoring. For the main reason to increase quality, to make sure that their staff is actually living up to the expectation of the customer. So, it's very important, if you want to embrace change, embrace data-driven cleaning. It helps you to optimize your efficiency. It can and will increase your hygiene and quality when using the system. And it will empower your team. So, as a summary, and to give a quote of Darwin, it's not those who are the strongest that survive, but those who are willing to adapt to change.
Thank you very much for your attention. So are you the one who is willing to adapt? We will answer all your questions in the next Q&A. Thank you very much.
Thank you.
Well, thank you, gentlemen, and welcome to the Q&A. Let's look at the chat to see what kind of questions came in. And who would want to embrace data-driven cleaning? There's a question from Leslie Davis. She asks, what are the thoughts behind using electrostatic processes? I'm not sure, was that not a question? Yeah, I think that's a question for you, but it was just recently asked. But maybe it was still for Professor Maillard, because you're both looking at me like I said something very weird. Fortunately, I do have some other questions as well. For example, data privacy is a big concern, especially in healthcare settings. And how can you ensure that data collection is safe and used appropriately?
Yeah, let me take that one. Thank you, Robert. Yeah, well, it's a simple question. It's a very delicate question, and we take it very carefully and very thoroughly. So we work according to the GDPR. So that's settled, for sure.
Good to hear that. And are there certain settings within healthcare facilities that are most suitable for data-driven solutions?
Well, yeah, it's a bit depending on what is your desire to improve quality and also improve your efficiency. But as long as if that's what you want and you want to keep your staff motivated, then it's good. So the gains or the benefits are bigger once the facility is bigger. So small facilities have less gain to win in terms of all these improvements on quality and efficiency.
Okay, good to hear that. And it looks like you definitely have someone in the audience who wants to adapt to speak with Darwin, because we have a question from someone from South Africa. If you have any representatives in South Africa?
Yeah, we do. We're spreading across the world, country by country. We have a global coverage as a global company. And I'm not sure whether this person will be in my breakout session, but we just make sure that they get our contact and we can talk afterwards.
Okay, sounds good. Another question is, how has does this technology also work in developing nations? Does that work with a lack of good Wi-Fi or maybe not a sufficient local technical expertise?
Well, it's no surprise that we started in Europe and the US to start with, because we don't have that difficulties in the different countries. But we are now exploring in other countries as well, for the same reasons to start with the system are, of course, still quality, hygiene, and your staff motivation. But sometimes technicalities can be in the way. It can even happen in the Benelux, but we have a standalone system that helps. That doesn't interfere with any company standards. So we just work with a SIM card, and that's quite straightforward. So if you can use your cell phone, you can more or less use Turkey Cube.
All right, sounds good. Looks like we also have someone who is concerned about the large investment that this product may take when clients are at the same time reducing their cleaning budgets. How do you respond to that?
Yeah. Sorry, Ruben. I think it's still my part.
Take it, Marco. Stage is yours.
Yeah. No. Quite simple answer. We have to do a business case and then see if it's still valid to work with the system. If it only costs you money, I would advise against it.
Okay. Well, final question. By looking at the time, I hope it's a question that Ruben can answer. The question from James. He is asking, I understand your approach for training would be delivered online, or is it offline?
Well,
he assumes
let me
offline.
take this one. I can see it here now.
You see it as well.
This one, we do both. Of course, the training for this integration of this products Marcel was talking about, that's an offline training, but we also have a nice program in place for online training to make sure you clean the hospitals the way you want. So you can train your staff the way you want, but it's a nice online training as well that you can adapt in 20 languages and adapt to your hospital facility or healthcare facility.
Okay, that sounds good. Well, thank you both for now. For the audience, don't go away because after the next presentation, Marcel and Ruben will both have their own breakout where you can get in touch with them directly and ask a lot of more questions or engage with peers about everything about data-driven cleaning. Here we're going to move on with the second presentation. Thank you again, Marcel and Ruben. And I'd like to ask Mark Israelson and Konstantinos Arapogianos to join me on the virtual stage. Mark and Kostas, as I can call him short, are both working for SteriSafe, a company from Denmark. SteriSafe is the business development manager for SteriSafe, and he has a deep knowledge about the technology of SteriSafe, and he has all about implementing this new product at their partners and clients. And Kostas is new to the company, and he works as a link between the real-life use of SteriSafe and the R&D department because he is actually a sensory scientist by education. Gentlemen, I'm going to let you give the presentation. In the meantime, if there are any questions by the audience, feel free to already drop them in our chat or save them for the breakout later on. But for now, the floor is to Mark and Kostas.
Thank you very much, Robert, for that great introduction. And thank you to Ruben and Marcel for the very interesting presentation. I will try to share my screen here. Hopefully it will work. Can you see my screen?
Yes. I see your screen, Mark. So I think everybody does.
Thank you very much. So I'm going to spend the next 10 minutes just to present you the future of disinfection in healthcare from SteriSafe's point of view. And to start with, I want to take you through history a little bit in order to present the future into a context that you can understand. So brief, we start in the mid-19th century here where the importance of cleanliness was discovered and documented that cleanliness actually decreases mortality rates. And this was kind of in the beginning of where you kind of made the link between dirty areas and mortality rates. So this was a very important discovery. Then we move on to a little bit later in time. That was in the late 19th century, where Clara Barton promoted clean and healthy conditions in the US Army. So this is where it became more standardized to actually clean areas and surfaces and adopt sanitation practices to protect people from infections. Then we move on to what is the beginning of the 20th century, where a huge discovery was made by Dr. Koch, who proved that microscopic organisms created diseases. And it was a very good discovery, you might say, to kind of get a better understanding for everyone to what was actually causing people to be sick. And it was also created a better understanding to know the enemy and have a face of what actually proved to be the cause of these infections. Then we move on to the mid 20th century, where hand hygiene, another big implementation or era, was introduced. And this, of course, is still very, very relevant today, as we heard in the previous presentations, that hand hygiene became the #1 factor for decreasing infections worldwide. And then as time went on, we're here in the late 20th century, where we started to become more aware of actually improving our environmental decontamination practices by using chemicals such as hydrogen peroxide or alcohol or parasitic acids to actually decontaminate the environments or the rooms. And now we are kind of in a new era in disinfection and hygiene, and it involves around what we call the IoT and automation here in the 21st century. And it's a little different because unlike the previous discoveries or practices, IoT and automation are not specific, say, hygiene practices, but it's actually industry-wide practices that every industry across the entire world is adopting more and more. However, if we exploit the benefits and innovations of IoT and automation in disinfection, it can really change the way we understand disinfection and the way we use disinfection, and it can also increase the processes of our disinfection procedures. So there is really a few key elements of today and the future of disinfection processes. The first is accountability, which we also discussed quite a lot in this webinar, is that ensuring that disinfection procedures consistently perform to required standards. Either it's individual organizational standards or global standards. And this can be achieved by using data and monitoring. Then we have another key element of the future of disinfection, which is safety. And the safety is kind of a twofold element. It can both mean, of course, increased focus on patient safety and operator safety in terms of not being in contact with dangerous chemicals, but also a little bit combined with accountability to actually prove and be safe that the room is actually disinfected to the standards you require. So when you enter a room, you are safe to know that this room is actually completely disinfected. And then there's a more global or more macro trend, you could call it, which also crosses boundaries of many industries, is the sustainability aspect. And that is implemented sustainable disinfection practices, but also user-friendliness. And this is both also a little twofold item, which you can say, because it's both in terms of having a sustainable, environmentally sustainable product or process, but also about the user-friendliness and actually less chemical exposure to people. And all of these elements can kind of be assured through IoT, Internet of Things, and automation. And now I'm gonna show you a little bit of how we at SteriSafe have ensured that all these elements are actually included in our innovative disinfection solutions. So we have the different drivers of quality and demand, accountability, safety, and sustainability. And what we have at SteriSafe is that we have a core disinfection technology. It's a technology, it's a robot that you roll into a room, and it fills the room with ozone gas. And it keeps the ozone concentration at a certain level for X amount of time. And then what it does is that the robot automatically purifies the ozone. It removes the ozone from the room after the disinfection and returns it back into oxygen again. And this is our entire solution and core technology. And with this technology, it's actually automated environmental disinfection solution, which gives accountability, because you know it performs consistently every time. And if it doesn't, it will tell you about it. We have the remote operation, which is also very good because there's no contact between the actual operators and the biocide, the ozone gas. It has a real-time monitoring, which will tell you the concentrations and all the variables in the room during disinfection. And it will also, of course, give an indication not to enter the room while the disinfection is in process and tell you when the room is safe to enter again. Because it's ozone, you can call it's a chemical-free biocide. No chemicals are needed. It's only needed electricity and water to do the disinfection process. And the biocide ozone is created in situ in the room. And then, as I mentioned before, we have the active removal of biocides and particle pollution in the room, which actually creates safe conditions afterwards. And then we have our supporting infrastructure, and this is where the IoT and datafication and automation really comes into play. And this is where we actually have a data-driven cloud system that our units, it actually monitors everything that goes on in the room, and it projects onto our cloud service, which means that you can get data from every disinfection cycle that you run. And this will also give you a validation report saying that now your room is disinfected to the current standards, and we can see that the different parameters of concentration of the biocide and the contact time has been reached. So now you can trust that this room has been disinfected. And this is an all automated process within the cloud infrastructure. We have the documented efficacy as well, which provides safety, and the cloud-based infrastructure and database. And then we have a GSM tracking system, which is very good for facility managers. If they have a fleet of disinfection units, they can keep track of where they are and how they operate all the time. And this is what we at SteriSafe coin as Hygiene 4.0, kind of taken from the connotation of Industry 4.0, of this IoT, datafication, and automation, bringing it into disinfection in healthcare. Of course, there's also somewhat a trend of going into Industry 5.0, which is more about AI. And we are not quite there yet, but that's definitely going to be a part of the future of disinfection as well. So what we do is that we normally operate, we're tailoring environmental disinfection solutions with focus on these three elements: accountability, safety, and sustainability. And we operate through facility management companies normally by providing our technology, of course, and our support and our training, where the facility management will stand for the day-to-day services, and of course providing our technology and disinfection robots to the healthcare organizations in which they operate. Our cloud, we call it the SteriSafe Stratos, is actually making sure that all the data is projected onto the cloud in two different facets. The facility management companies will get benefits from multi-site management, tracking all the units, but also be very fast and reactive if there is any service or maintenance required on individual units out there. And of course, the healthcare organizations will get automated reporting by the monitoring systems that we have in our solutions. And by monitoring and making accountability and safety and sustainability, the healthcare organizations will benefit, of course, from a safe environment. So with SteriSafe, we are, of course, always looking for partners who wants to be ahead of the curve, so to speak, and lead innovative disinfection procedures into the 21st century. in order to bring an end to healthcare associated infections. This is our main vision in our company, and this is what we want to combat. And we want to do this by bringing IoT and datafication into disinfection procedures and lead the future of disinfection in healthcare. Thank you very much for listening. I hope you enjoyed.
Thank you, Mark, for a very interesting presentation on a novel product for sure. There are already some questions coming in the chat. Some were already answered by Kostas, but I'll repeat the questions quickly for those who were not monitoring the chat. It was asked, does it disinfect both air and surfaces, to which Kostas replied that it is indeed the case. And then a more technical question as a follow-up, does it create ozone in the room? And Kostas replied, yes, it creates ozone in situ by solely using the oxygen in the air. Another question was, can it work with medical equipment in the room? Kostas, again, maybe you can answer this one live.
Yes, there is no problem in using the technology with electronic equipment, and more specifically, when it comes to medical equipment, we can see case by case in terms of material compatibility.
All right, and how fast does it work per cubic meter? That's also a question in the chat.
Do you want me to take that, Kostas?
I don't mind. I could take it either. You take it. I took all the other ones.
Yeah, so per cubic meter is a little difficult to tell. Normally, we have an almost sized, what you say, operating theater, for example. We say that it's 90 cubic meters. It will take approximately 2 hours to run a full disinfection cycle from the beginning till it's safe to enter again.
And then another question is, and I think I know the answer, do people need to leave the room when the robot is working? I think so. Do they need to leave only for those 2 hours that you mentioned, or is the room then immediately safe, or do they need to leave the room longer?
Yeah, so yeah, of course, with this technology, like any other environmental disinfection solutions, you need to leave the room. There can be no people present, either patients or operators, of course. And yeah, you only need to leave the room for the span of the disinfection. So that is these 2 hours in the standard room that I mentioned.
All right, all right. Do you have some use cases where this product is already being used in hospitals, or is it still a prototype?
Kostas, you want to take this one?
Yes, actually we do have, and that's something I wanted to discuss in the breakout room. So it's a nice segue for what comes next. We do have a case in Germany, for example, now that it is in a way bringing like a legal pool, and it brings the accountability, which in Germany now they're requiring more and more to, based on a norm, DIN 17272 to be more specific, that they require the contract cleaners to disinfect their how is it called? Their
cleaning trolleys.
The cleaning trolleys. So this is something that we are working now to create a solution for them that automatically they can disinfect, not one by one and manually, but disinfect all the cleaning trolleys in one go. And that would actually create some benefits for them, both on cost for saving time in disinfection.
Yeah, just to follow up on that, we are present in all of Europe and also in Asia and the Middle East area.
Very interesting. Final question before we move to the breakouts. Do you clean before, or do you just send in the robot?
Nah, like Johnny Wimeyard also said, that there is a distinction between cleaning and disinfection, and you do need to, of course, remove the soiling in the room before you run a disinfection cycle.
Okay, good. Well, then one far-off question. I assume it will kill all organisms in the room, even macro or just micro?
Yes, all organisms.
All organisms.
It's a gas, so it spreads everywhere in the room very easily, and that's why it takes the entire room and all microorganisms. Yes.
All right, sounds very good. And then it's time to move to our breakout rooms, to our final and third breakout room session. We're going to split the audience up again in four breakout groups. One moderated by Mark Israelson, one moderated by Kostas Arapijonas, and one breakout moderated by Marcel from Torque that we just saw 10 minutes ago, and one by Ruben from Torque. In the breakout, you'll have some time to talk further about either data-driven technology or the new ozone disinfection robot from SteriSafe. I'm going to ask my colleagues to press the magic breakout button again. Please bear with us when the system transfers you to your breakout room, and then you will be back here in about 10 minutes. Thank you for now. With us, yes, it's going very quickly. And I think we're waiting for one more group to return. Yeah, I think this is it. Welcome back to the main room after our third and final breakout session. I'd like to ask the breakout moderators to turn on their cameras again. Just waiting for Mark. Yes, there he is. Well, we're almost at the end of our session for today. Maybe just a quick feedback on the breakouts. Marcel, what was your experience?
Good interaction. Thank you, my audience, for being so open-hearted and talk to me about your day-to-day business. Interesting to see that most of people feel like a data-driven solution is the future, but there are some hesitations in terms of how to implement it. And yeah, that's only logic. That's only fair. And I must say that yeah, it was good discussion.
Sounds like a very nice experience. From our other two moderators, Mark, what was your feedback? Did you get any interesting new insights? You're muted, Mark. Mark, you are muted.
Sorry. Not a lot of insights, I was saying, but a lot of questions. So that was very good to have some time to answer a lot of these questions that I didn't include in the presentation. It is quite of also a large topic to cover in 10 minutes, but yeah, very positive feedback from here.
Good to hear that. Well, and with that, I'd like to conclude this first Interclean online inspiration and innovation session. I'd like to thank our moderators from this hour. I'd like to thank our panelists and speakers from the first hour. And of course, I'd like to thank the audience back home for tuning in, especially those from the Netherlands, because it's a beautiful day outside, and I know it's probably the last day of summer. So thank you for taking the time to join us here and not going to the beach. Join us again on November 30th for our next session, which will be about sustainability, and what you can do to make sustainability your leading criteria in your cleaning and hygiene strategy. I look very much forward to seeing you there. And of course, I look even more forward to seeing you in May 2022 in this beautiful hall behind me. Have a very nice day, and until the next time, thank you very much.
Bye-bye, thank you.